Welcome to Smart Wellness Tips. Today, we explore a critical medical emergency where every single second determines life or death. The human brain is the command center of our existence, a complex network requiring constant blood flow to function correctly. A stroke occurs when this vital blood flow is suddenly interrupted, starving the brain cells of oxygen and essential nutrients. Dr. Andre, a renowned cardiologist, emphasizes a concept that everyone must remember to save lives. Time is always brain. When a stroke strikes, we are racing against a ruthless clock, where hesitation leads to irreversible damage to your mind. The medical definition is precise. A stroke is a neurological deficit caused by an acute focal injury to the CNS. For every minute that passes without treatment, nearly 2 million neurons die, and 14 billion synapses are lost forever. In just 1 hour without blood flow, the brain ages by nearly 4 years, highlighting the extreme urgency of treatment. Understanding the types of stroke is the first step in recognizing the symptoms and seeking the correct medical intervention immediately. There are 2 main types of stroke that we encounter, and they have very different causes but equally devastating effects. The most common type, accounting for 85% of cases, is the ischemic stroke caused by a sudden blockage. Imagine a boulder falling onto a highway. Traffic stops completely. This is exactly what happens inside a blocked brain artery. These clots can form from plaque buildup in the arteries or travel from the heart due to irregular heart rhythms. Atrial fibrillation is a common culprit, where the heart flutters and shoots clots directly into the delicate vessels of the brain. Without oxygen-rich blood, the affected brain tissue begins to suffocate immediately, leading to the rapid death of functional neurons. The second type is the hemorrhagic stroke, which accounts for the remaining 15% of all stroke cases globally. This occurs when a weakened blood vessel ruptures, causing blood to leak into the brain and compress the tissue. The leaked blood creates immense pressure inside the skull, damaging brain cells not just by starvation but by physical crushing. Doctors can quickly distinguish between these 2 types using a CT scan, which is crucial for determining the treatment. Hemorrhagic strokes are often described as the worst headache of your life, striking suddenly with intense and overwhelming pain. To save a life, you must memorize the acronym B FAST. It is the gold standard for recognizing stroke symptoms. B stands for balance. Does the person suffer a sudden loss of balance or coordination, making it hard to walk? It is not just clumsiness. It is a profound and sudden inability to stay upright or walk in a straight line. E stands for eyes. Check for sudden vision changes, such as double vision or total loss of sight in one eye. They might describe a dark curtain falling over their vision, or seeing 2 objects instead of 1, appearing very suddenly. F stands for face. Ask the person to smile. Does one side of the face droop or feel numb and heavy? This uneven smile is a classic sign of a stroke, indicating that the nerves controlling facial muscles are being damaged. A stands for arm. Ask them to raise both arms. Does one arm drift downward, or is it impossible to lift? Weakness or numbness usually affects just one side of the body, mirroring the specific side of the brain being injured. S stands for speech. Is their speech slurred? Are they unable to speak, or do they sound confused and strange? They might understand you but be unable to form words, or they might speak fluently but say things that mean nothing. T stands for time. If you observe any of these signs, call emergency services immediately. Do not wait to see. Note the exact time symptoms started. This information is vital for doctors to decide which life-saving treatments can be used. Once at the hospital, the medical team will race to confirm the type of stroke using advanced brain imaging technology. Remember, we are fighting to save the penumbra, the area of the brain that is stunned but not yet dead. Modern medicine offers us 2 miracles. The first is thrombolysis, often called the clot buster shot, administered through a vein. This powerful chemical travels through your body to find the blockage and dissolve the clot, causing the ischemic stroke. It works by breaking down the protein mesh that holds the clot together, restoring blood flow to the starving brain. However, this drug has a strict time limit. It is generally most effective only within 4.5 hours. If you arrive too late, the risk of bleeding outweighs the benefits, and this miracle drug cannot be safely administered. But, when given in time, patients can see dramatic recoveries, sometimes regaining speech and movement right on the treatment table. This is why getting to the hospital immediately is so crucial. You are buying the chance for a complete cure. For larger clots that medication cannot dissolve, we have a second miracle: mechanical thrombectomy, a minimally invasive surgical procedure. Doctors insert a long, thin tube called a catheter into an artery in the leg and navigate it upwards. Guided by real-time X-ray imaging, this device travels all the way up to the blocked vessel inside the brain. Once it reaches the site of the stroke, the device is deployed to physically capture the clot, causing the damage. A device, often a stent retriever, expands within the blocked vessel to entrap the clot securely within its mesh. The doctor then gently pulls the device back out of the body, removing the blockage and restoring blood flow instantly. In other cases, powerful suction tubes are used to vacuum the clot out, similar to drinking a smoothie through a straw. Remarkably, this mechanical procedure can sometimes be performed up to 24 hours after symptoms begin in specific eligible patients. The difference is night and day. We go from a brain starving to death to a brain fully perfused again. Patients who might have faced severe disability or death can walk out of the hospital thanks to these advanced technologies. However, not every patient is a candidate. It depends on the clot location and how much brain tissue is saved. If the core of dead tissue is already too large, restoring blood flow might cause bleeding rather than saving function. This brings us back to the most critical point. The earlier you arrive, the more options we have to help. Survival is just the first step. Post-stroke care and rehabilitation are essential for regaining independence and quality of life. The brain is incredibly plastic. With practice, healthy parts of the brain can learn to take over for damaged areas. Recovery is a marathon, not a sprint. It requires patience, dedication, and the support of a loving care team. But the best treatment for stroke is preventing it from ever happening. 80% of strokes are actually preventable. High blood pressure is the silent killer. Monitor it regularly and keep it under control with diet and medication. Physical activity is a powerful shield. Just 30 minutes of moderate exercise daily can significantly reduce your stroke risk. Adopt a heart-healthy diet. Reduce salt intake, avoid processed foods, and embrace fresh vegetables, fruits, and healthy fats. If you smoke, quitting is the single best thing you can do for your blood vessels and brain health. Check for atrial fibrillation. An irregular heartbeat can cause clots, so catch it early and treat it with blood thinners. Let us recap the vital lessons. Stroke is an emergency. Time is brain, and you must know the signs. Balance. Eyes, face, arm, speech, time. Memorize this sequence. Teach it to your children and your elderly parents. You might be the only person around when a stroke strikes a loved one. Your quick action makes the difference. Medicine has advanced incredibly. We have the tools to pull people back from the brink, but we need your help. Protect your brain. It holds your memories, your personality, and your ability to connect with the world around you. Do not ignore temporary symptoms that go away. These mini-strokes are major warning signs that a big stroke is coming. These transient ischemic attacks are your body screaming for help. Go to the hospital even if you feel better. Stroke is more common than you think. Every 40 seconds, someone in the United States suffers a stroke event. It does not just affect the elderly. Young adults and even children can suffer strokes, though it is less common. Support systems are vital. The journey after a stroke can be emotionally and physically taxing for both patients and families. Connecting with support groups can provide comfort and practical advice for navigating the new normal of life after stroke. The future is bright. Artificial intelligence is now helping doctors detect strokes faster and more accurately than ever before. Mobile stroke units are bringing the hospital to the driveway, scanning and treating patients before they even reach the ER. These innovations are shaving precious minutes off treatment times, saving millions of neurons and preserving quality of life. Do not wait for a crisis. Schedule your annual checkup. Know your numbers, blood pressure, cholesterol, and blood sugar. Diabetes is a major risk factor. High blood sugar damages blood vessels over time, making them prone to clots. Treat sleep apnea. Stopping breathing at night stresses the heart and raises stroke risk. A CPAP machine helps immensely. Limit alcohol consumption. Excessive drinking raises blood pressure and can trigger irregular heartbeats that lead to stroke. Manage your stress. Chronic stress keeps your blood pressure high. Find healthy ways to relax and decompress daily. Remember that while the drug window is short, the mechanical window extends to 24 hours for some patients. This extended window for mechanical thrombectomy has revolutionized stroke care, allowing us to save patients we previously could not. Stroke care is a team sport. It involves paramedics, emergency doctors, neurologists, radiologists, and nurses working in unison. The goal of all this technology and speed is simple: to return you to your life and your loved ones. Equip yourself with knowledge. There are apps that help you identify stroke signs and find the nearest stroke center. Never drive yourself or a loved one to the hospital if you suspect a stroke. Call an ambulance immediately. Paramedics can alert the hospital before you arrive, clearing the way for immediate scanning and treatment upon arrival. Denial is dangerous. Hoping symptoms will pass can lead to a lifetime of disability that could have been prevented. Many public figures have survived strokes and returned to their careers, proving that recovery is possible with quick action. If you have had a stroke, taking your prescribed medications is non-negotiable to prevent a second, more deadly event. Blood thinners and antiplatelet drugs are often prescribed to keep your blood flowing smoothly and prevent future clots. Statins may be used to lower cholesterol and stabilize plaque, reducing the risk of it rupturing and causing blockages. Prioritize sleep. During deep sleep, the brain clears out toxins. Poor sleep is linked to higher stroke risk. Stay hydrated. Dehydration thickens your blood, making it harder for your heart to pump and easier to clot. Cultivate joy and social connections. Loneliness and depression can negatively impact your heart health and increase stroke risk. Knowledge is your superpower. By watching this video, you have equipped yourself to be a lifesaver in your community. Please share this information. You never know whose life you might save simply by spreading awareness about stroke symptoms. Thank you for joining us on this deep dive into stroke prevention, recognition, and the miracles of modern treatment. Life is beautiful and fragile. Protect it by making smart choices every day and being ready to act fast. Never forget, time is brain. Every minute matters. Speed saves lives. Be the hero who acts without hesitation. Have you or a loved one been affected by a stroke? Share your story in the comments to inspire others. If you found this video valuable, please subscribe to Smart Wellness Tips for more life-saving medical insights. Stay tuned for our upcoming video, where we will discuss the top foods to naturally clean your arteries. Take a moment to breathe deeply. Stress reduction starts now. Your health is the most valuable investment you make. Listen to your body. It whispers before it screams. Paying attention to small changes can prevent major medical emergencies. This content is based on the latest guidelines from leading stroke associations and expert medical consensus for your safety. Remember, this video is for educational purposes. Always consult with your healthcare provider for personal medical advice and treatment. From all of us here, we wish you health, happiness, and a long life free from the burden of stroke. Stay smart, stay healthy, and take care of your amazing brain. We will see you in the next video. Goodbye for now.